that we don't want his law. We don't need his law. We have to remove the law.
Montreal doctors are warning that Quebec's Bill 2, a controversial law linking physicians' pay to performance targets, could limit care for children. On Sunday at a press conference at CHU Sainte-Justine, pediatric specialists and care teams said the law threatens access to family doctors for babies and young children and risks delaying preventative care.
We're here to share our very big concern about the fact that children are completely dismissed in the current law. They're considered a non-vulnerable population.
Quebec's color-coded vulnerability level system used to prioritize patients is also a worry for pediatricians. Under that system, they worry that young children and babies are at risk of being classified as lower urgency more often, even when their symptoms may require closer attention.
So those color classification, they put the green for all the children. So we prove that if we work earlier with the children, the results are better. So if they have all green, of course when they're going to come in pediatric hospital, they're going to be red, but sometimes it's going to be too late.
So I think in a year we'll have some children that will come to us much sicker than they would have been if they would have been identified correctly at the primary care level.
Doctors also warn the law is accelerating an exodus. Since the government pushed Bill 2 through in late October, close to 400 Quebec physicians have applied to practice elsewhere, raising fears of deeper shortages in the years ahead.
And in 15 to 20 years from now, I'll be super worried that no new development, no new treatment will be provided to children, the future children of Quebec, because nobody will want to come and work in a province where they dismiss innovation, research, quality of care, teaching.
Specifically here at Sainte-Justine and in all the 4 pediatric hospitals, we go after our training, we go for another fellowship outside Quebec normally. What's going to happen? Those guys going to come back? Never. They won't come back.
In a statement to City News, the Office of Quebec's Health Minister Christian-Dubé said, "We understand the concerns raised, especially regarding children. Bill 2 does not change the ability of pediatricians, including subspecialists, to provide the necessary care, nor the time they must dedicate to complex follow-ups. For pediatrics, the plan targets relate solely to coverage plans and access times to the CRDS. Currently, 97% of requests are processed on time, and we are aiming for 99% by summer 2026. In this context, pediatricians should retain their full collective compensation."
And we're going to continue fighting for the children of Quebec.
We never stop. Never.
In Montreal, Lola Kalder, City News.